issue of vaccination. For example, the issue of nurses who are taken from clinics into the vaccine site to assist with the vaccination. It's something that we are paying attention to. We've asked all provinces to give us their need in terms of numbers and what interventions can be done, and that will be attended to urgently. That's the first thing, because that has come back to say the capacity. We've removed nurses to some of the nurses in the areas from the clinics into our vaccine site, and therefore it affects the quality of service and the work that has to be done, especially for primary health care. So that we are paying attention to it, honorable members. Second issue, it's the issue of where the system, EVDS, the system that we are using, that, for example, somebody would register. When that person registers, then an SMS delays to come to give them a notification on when to go on site to vaccinate. And this is particularly with our population category 60 years and above. So when looking at that, we have paid attention. I had a meeting with the team that is working on the system just to look at what is the issue. Now, part of what is happening, and this is what we have to intensify in our communication methods, and we are looking at various areas that will assist us in communicating. The first thing is that because the sites first were limited, and as we continue to upgrade them, you find that people will be redirected to various sites as they come. So sometimes you have the delay. So one of the officials actually utilized himself as an example to say, I traced the time it took for me to go to vaccinate, and I realized that the system was actually correct, and this was within the system in terms of registration. Now, what we are now paying attention to, how do we ensure that we sort out this problem of anxiety from the senior citizens in terms of saying, I've registered and then it takes long for me to get the notification for me to vaccinate. And this has led as well to the walk-ins, what we would call walk-ins, where somebody has registered online, they don't get a message, and then they decide to walk into the site so that they can vaccinate. What I can say currently, honorable members, is that people have not been turned back when they arrive, they've been assisted. But we are utilizing, I've asked the team to look at the example of Limpopo, where Limpopo shared the example of how they've managed to do a coordinated approach, and then would, out of that, then take to the IMC of vaccine, which is chaired by the Deputy President, new protocols of what we think would be a walk-in protocols. The reason why we need protocols for walk-ins is that we do not want our vaccination sectors to become the source of the spread. Because if you do not have a controlled measure, you can wake up with more than 100 people walking in saying we are here to vaccinate. So there is a need for us to manage that number in terms of going, and hence the protocols would have to be in place. So that we are paying attention to in terms of the system, in terms of registration. The second area on the issue of the system, colleagues, would be that somebody would have gone to the site, vaccinate. I know as members in your constituencies, you would have received such queries, and the senior citizen would have been given a date written down on a card when they went home. And then when they are home, on their messages, they would receive an SMS that changes the date. The explanation that we would need to give you and the public is that, firstly, when we started the rollout, especially on the Pfizer vaccine, where it's 2 jabs, is that firstly, it was indicated that it would be 21 days between the first jab and the second jab. Now, later, global statement and regulation came out to say it's now 42 days. So we are now following 42 days. So the message that a senior citizen will get, or the 60 plus will get, that changes that date, the original date, to the second date, is informed by that. So its movement, it would have been, the first date would have been on the basis of 21 days. Then the second date is on the basis of 42 days. Now we are urging that what needs to be kept and applied and followed is the second date that is sent as an SMS, that is 42 days. So we are urging our young people who have senior citizens in their homes to verify that and assist their senior citizens who maybe perhaps might not be able to read and write, specifically to be able to make sure that they go back on the right date. The other issue that we are paying attention to, honorable members, and yesterday it was a meeting of the MEC on social behavior, is the slow registration number. If you look at the numbers that we have in terms of the population of 60 plus, in terms of what Stats SA has provided, it's almost around 5.5 million. And when you look at our registration and the vaccination, you see that we are not yet at 60%, which is worrying us. Now, part of what we had to go back and learn about it, understand, there's a report that has been produced by one of the researchers in UK that I'm going through. I received it last night, for example, that almost gives some analysis in terms of studies in the communities, why people have not been able to register and all those things. But key issues that are coming out, one is the issue of what we are finding in our public in terms of the fear of vaccination. And this is informed by fake news, misinformation, and all that. And we need to ensure, one of the things that we said will intensify is countering in terms of the message that goes out into public around the vaccination rollout, to make sure that what is real, what is serious, what is truthful is what gets to our public. That's the first thing. The second issue would be the issue around accessibility to the system by senior citizens, many of them that would have utilized in terms of their children in home. For example, I would have registered my mother. So that is what we are picking up. Hence, some of the provinces and most of them now moving into ensuring that we have community healthcare workers who go into the houses to register the senior citizens. So that's one of the things that is very critical that has been identified. And that's one of the things that we are responding to. In terms of the vaccine availability as well, that will come in for members to be able to deal with and receive in detail on the presentation in terms of vaccine rollout availability and what is seen as the pipeline for vaccine. So, Chairperson, through you, I would like to request that the team presents. I was doing an overview in terms of where the issues are and what lessons we are learning. If you will allow us, because to complete this story and for members to have a full picture of what is happening, I would request that the presentation is received on this matter and then we proceed. And I would like the DG to start, Chair, through you, with the presentation.
Okay, thank you very much. DG, you can then start. Thanks for the overview, Minister.
Thank you very much, Minister. Thank you very much, Chair, Deputy Minister, honorable members and colleagues. Honorable Chair, we have lined up our presentations as follows. We'll have Dr. Tulare doing the epidemiology and the latest status in terms of surveillance. And Dr. Tulare will then be followed by Mr. Morewane, who will then go through the facility readiness for the third wave and where we are in terms of beds, oxygen, and all that has to do with the readiness. Thereafter, I will then come in and do a presentation on the digital vibes matter. With the indulgence of the Chair, I would like to hand over to Dr. Tulare to do the first part of the presentation.
Good morning, Honorable Chair, honorable members of the Portfolio Committee, and Minister, Deputy Minister, and colleagues. I am going to do a presentation. In terms of the presentation outline, we are going to be focusing on the following areas. Firstly, epidemiology and surveillance, and then monitoring of the resurgence, an update on registration and vaccinations, the pipeline of vaccine supply, the capacities in the public and private sectors, and we'll touch on planning for vaccination of public and private sector workers, and then some recommendations. In terms of epidemiology and surveillance, we want to indicate to the Portfolio Committee that the cumulative number of infections that have been reported in the country now stands at 1.774 as of the 6 million as of the 16th of June 2021. This is a 0.75 increase from the previous day, and as of yesterday, we had 13,246 new cases, which is the highest number that we have experienced since the beginning of the resurgence. And what we also want to report on is that there are currently 95,772 active cases in the country and over the past 24 hours. And the total admissions in the public and private sector hospitals is now at 8,727, and hospitalizations have breached the 8,000 mark, the first time this has been recorded since February 2021. Our case fatality rate as of the 16th of June is 3.3%, and cumulative number of deaths are standing at 58,223, reflecting an increase of 136 reported deaths as of 1800 hours on the 16th of June. And this is just another representation of what I have presented, but just to report back that the majority of the cases that have been reported on the 16th of June were from Gauteng, which accounted for 7,859 new cases, followed by Western Cape with 1,402, the Northwest with 917, Free State 617, and KZN 592. The lowest proportion of new cases are in Mpumalanga, Eastern Cape, and Northern Cape. Next slide, please. And then we just want to also demonstrate the 7-day moving average of new cases by province and data reporting as of from the 13th of April to date. What we can see is that if you look at all the provinces combined, Gauteng has started to really move up very acutely. We can see that the steep of the rise is quite concerning. And then we can see that following this, Western Cape is coming behind, and followed by KwaZulu-Natal, which is also trailing behind. What is also worrying is that it seems as if all the provinces are moving upward. There is not even one single province that is showing a flat gradient. So all the provinces are in trouble. And then if you look at the reproduction rate of the virus, we can see that we are now at 1.25, and this reproduction rate tells us the number of people that one person can infect. And if it's less than 1, we know that the rate of infection will decrease. But if it's more than 1, then it tells us that the rate of infection will increase because the person can infect more than one person. Next slide, please. What we want to demonstrate on this slide, Chairperson and honorable members, is that if you look at the average daily number of tests each week, we have increased the numbers of tests that have been conducted, meaning that the need for testing has risen and there are more people requiring testing. But if you look at the weekly proportion of those tests that have tested positive, you can see that now we are lying at 14.3%, which is a very concerning figure. We were at the bottom end of the previous peak at 3.8%, but we have really moved to a higher level of proportion of test positives, which is at 14.3%. If you look at this positivity percentage, we can see that it's higher in Gauteng, which is now at 27%, and it's also going up in Limpopo, Western Cape, Free State, and KZN, whereas in Northwest and Northern Cape, the percentage positivity has declined in Northwest from 22% to 17%, and then in the Northern Cape from 18% to 17%. Provinces that have remained unchanged are Eastern Cape and, the previous slide, outstanding. It's Mpumalanga and Eastern Cape, but it does not mean that we must not watch them, because we have seen in the previous slide that all provinces are on the rise. Next slide. Then if we look at this, we are breaking down provinces, looking at confirmed cases by province. We can see that Gauteng is going up. It's the red line. And then Northern Cape is going down. but other provinces are all rising. You can see Free State went up, then went down, but it's going up again. Northwest is still going up. And then we can see that the other provinces, all the other provinces, including Limpopo and Mpumalanga, are all on the rise. And then nationally, we can see that the national average is also on the ascent. Next slide, please. And then this is a magnification of the previous slide, just showing all the provinces, how they are changing. Northern Cape, which is the green one, is on the decline, but all the other provinces are on the rise, including Mpumalanga, including KwaZulu-Natal, and including Limpopo. Then if we look at a number of cases per 100,000, starting from the 17th of May and going on a weekly basis through the various provinces, we can see that when we started on the 17th of May, the province that had more than 15 cases per 100,000 was Northern Cape. And gradually, as the color becomes more red, we can see that the other provinces are slowly following. It started with Free State on the 31st of May, and then on the 7th of June, Gauteng is now the province that has got more than 15 cases per 100,000. What we also note is that when we started on the 17th of May, Western Cape was a light yellow, which meant that they had less than between 0 and 4.99 cases per 100,000. But now, as of the 7th of June, their color has become more dark. It's between 5 and 9.9 per 100,000 cases. And then all the other provinces that were of concern, which is Northwest and Free State, are also recording high numbers, and we are monitoring the other provinces, Limpopo, Mpumalanga, KZN, and Eastern Cape. Then if you look at the hospitalization trends by province, we have divided them into high-burdened provinces and lower-burdened provinces, and we can see that in terms of the high-burdened provinces, Gauteng is leading the race in terms of the number of people that are hospitalized. They are followed by Western Cape, KwaZulu-Natal, and then Eastern Cape, even though they are still right at the bottom, but there's an upward inflection on their graph. So all our provinces are in trouble, but the provinces that are most in trouble is Gauteng, followed by Western Cape. And then if you look at the lower burdened provinces, you can see that in terms of the provinces that have got a higher level of hospitalization, it's Free State, followed by Northwest. And then we can see that Mpumalanga and Northern Cape are trailing behind, but they are also showing an upward inflection, including Limpopo. What we note also is that Northern Cape, even though it appears as if it's low because of its capacities and its population, really the numbers are of concern. Next slide, please. Then summarizing this, what we want to reflect on to the portfolio committee is that the COVID cases have continued to increase for the 6th consecutive week. In the last 7 days, from the 7th to 13th of June, there was a 50% increase to 50,518 from 33,739 cases in the preceding 7 days. And in the 14 days comparison shows that the cases increased substantially from 49,000 in the preceding 14 days to 84,000 in the last 14 days, with an overall 72% increase. In terms of deaths, we have had deaths increasing by 47.85% in the last 7 days, and preceding 14 days, they increased from 7.89% to 1,326 in the last 14 days compared to the preceding 14 days. And the case fatality ratio is 3.31%. And then Eastern Cape, Gauteng, and KwaZulu-Natal and Western Cape account for 79% of all the reported deaths. In terms of our healthcare workers, there were 64 healthcare workers who tested positive in the last 7 days, and cumulatively 57,069 healthcare workers have tested positive, and of these, 14% required admission and have been discharged. Currently, we have got 89 that are admitted, and healthcare workers constitute 3.27% of all cases reported in the country. Cumulatively, 887 healthcare workers have succumbed to the virus, and they've been recorded as so, with a case fatality rate of 0.98%. In terms of a summary of the indicators, what we want to show here is that in terms of percentage change in new cases in the last 7 days, meaning from the 7th of June to the 13th of June, the provinces that have seen a high percentage change are KwaZulu-Natal, followed by Gauteng, Western Cape, and Eastern Cape. But what we can also note is that those that have surpassed the national average are Gauteng, KwaZulu-Natal, and Western Cape, whilst the others are trailing behind. But one is noting that some of the provinces are close to reaching that national average. And then if you look at the percentage change in the past 4 years, the provinces that are worrying are Limpopo, which has had a 124% change, meaning in terms of increases in positivity, and then followed by Gauteng, Western Cape, and KwaZulu-Natal, and the Eastern Cape. So what we want to say here is that even though Eastern Cape appears to be trailing way behind, the number of the percentage change in terms of positivity in the last 14 days is quite significant. Next slide, please. Then here we want to show in terms of expected and actual all-cause death during COVID-19. The green line shows what had been predicted by our scientists at the Medical Research Council of predicted deaths during this period. And then the red line shows the recorded deaths based on our statistics. And then following the black line shows the cases that have been recorded as the cases that have died of COVID. So we just want to demonstrate this, and so that when our numbers are reconciled in future, we understand how this has panned out. Next slide. This slide is showing our resurgence monitoring. And what we are saying is that if you look at the red line, the dotted red line, that is on top of the graph on the left, we can see that a new wave threshold, which has been defined as 30% of the peak 7-day moving average of the previous wave, which is shown on the right. You can see that the previous wave, which was in December, January, we are now, if you compare it with the trajectory of the current wave, we have surpassed the 30% line, which was 5,959. And what it is showing also is that the inflection point is becoming quite steep. And this can be explained also by what is happening in Gauteng, where we can demonstrate that we have now surpassed the threshold that we had set for ourselves, and we are now in the new wave threshold, which the minister had spoken to. We crossed this new wave threshold on the 10th of June 2021. Next slide, please. Then we want to give a provincial breakdown of where we are in terms of crossing the new wave threshold. We can see that the provinces that have crossed that threshold, Free State, we can see that they crossed it quite long ago in terms of what this graph is showing. And Gauteng also crossed the new wave threshold. And then we can see that KwaZulu-Natal, Limpopo have not yet crossed the threshold, but Mpumalanga is quickly approaching the threshold. Northwest and Northern Cape have never really come out of this, but Northern Cape in particular, it has been lingering above the new wave threshold. Western Cape appears to be coming strongly, showing that it will be crossing the new wave threshold very, very soon. Then we want to update the portfolio committee on the vaccination. We remind the portfolio committee of where we are at this present moment. This slide has been presented previously. We are now in the block that is marked in red, where we have said that we'll be vaccinating those that are above 60, and we'll continue vaccinating those until the 16th of July. But also starting during this block is the 40-plus population of workers, and we will be continuing with this until we have covered the entire population of those that are workers eligible for vaccination. And what we had also indicated is that we'll be using various platforms to vaccinate this. The trigger point is that if we have reached around 70% of the targeted population, will move to the next population that has been categorized. Next slide, please. So in terms of registrations, as of the 16th of June, people who have registered on the EVDS, the Electronic Vaccine Data System, is 3.574 million people. And of this is 951,000 healthcare workers. And those that are above the age of 60 are 2.623 million people. And then what you want to demonstrate in this is that we've got provinces that have shown a higher level of registration based on the population density, being Gauteng, Eastern Cape, Western Cape, and KZN. But we see a very, very interesting phenomenon in Limpopo, which has shown, even though it's a rural province, that those that are above the age of 60 have shown market enthusiasm in registering. And we think that there is something that we can learn from this. Before we move on off from this slide, we just also want to reflect that if we look at our numbers, we can see that we have got those that are above the age of 60. Previously, we had indicated that we have got a target population of 5.5 million citizens that are above the age of 60, but we have managed to register 2.623 individuals that are above the age of 60. And we think that, this is what the minister was referring to, that other efforts have to be put in place to stimulate a demand for that population that is above 60, including using our community health workers and taking a government-wide approach of stimulating a demand through a registration on the EVDS. Then in terms of vaccinations, if you look at the total number of people that have been vaccinated using the Sisonke Johnson & Johnson vaccine and the Pfizer first dose vaccine, as of the 16th of June, we have 1.973 million people that have been vaccinated. And we can see that the provinces that have vaccinated more are Gauteng, KwaZulu-Natal, and Western Cape, and Limpopo and Eastern Cape are following behind. And what is also interesting is that Limpopo, in terms of the population. Next slide, Oskani. In terms of the people that have been vaccinated through the Sisonke vaccination program, being healthcare workers, we have got the number of 479,000 people, and Gauteng has vaccinated more of these individuals. Next slide, please. In terms of the first dose Pfizer vaccination, as of the 16th of June, we have 1,490,000 people that have vaccinated using the Pfizer first dose vaccination. But what we wanted to demonstrate on the right side of the slide at the right bottom corner is that we can see that we have got peaks and troughs in terms of the trends of vaccinations. And then the troughs what happens over the weekends. And then we are in discussions with our provinces and our partners who are vaccinating to ramp up their vaccinations over the weekends. And this will require that other provisions are catered for, including overtime for our healthcare workers who are vaccinating. We just wanted to also demonstrate that in terms of the global picture, we can see that all provinces have ramped up their vaccinations. We can see in terms of the gradients that the provinces, some of them started slowly. If you look at a province like the Western Cape and the Free State, where initially the gradient was flat, but thereafter they've started ramping up.
Point of order, Chairperson.
Point, Honorable Chiro.
Chairperson, there are various comments and concerns being raised in the WhatsApp group, and you're not responding in relation to us asking questions now. And you're not responding as the chairperson. We're asking to ask relevant questions in this particular setting, especially noting that the minister is going to leave soon. We want to ask questions. Can you give us an opportunity to do so? And then they'll continue with their presentation after we have asked questions we want to ask.
The minister said she will extend her stay till 12:30. So can we continue the presentation? Continue, Dr. Tulare.
If we can have the next slide, Austin. Then we will highlight the pipeline distribution and the sites that are active for vaccination. In terms of our pipeline, we have got three pipelines. The first one is the Johnson & Johnson, where we are expecting 2.8 million doses in Q2, 9.1 million doses in Q3, and 19.1 million doses in Q4, amounting to 31 million doses. For the Pfizer that we're acquiring through bilateral discussions with Pfizer, we have indicated even previously that in Q2, we are receiving 4.4 million doses, Q3, 16.5 million doses, and in Q4, 8.9 million doses. And then additionally, through the COVAX facility, we will be receiving 1.392 million doses from Pfizer. This totals 45 million people that are going to be vaccinated through this pipeline, noting that J&J is a single-dose vaccination, and then Pfizer is a two-dose vaccine. So the 31 million doses will allow us to vaccinate 15.6 million people. And then in terms of the schedule, Ostani, the previous slide. In terms of the weekly schedule, we will be receiving 300,000 doses of Johnson & Johnson tomorrow on the 14th. And then next week, we'll be receiving 1.2 million doses from Johnson & Johnson. In terms of Pfizer, we are receiving 636,000 doses on the 14th, which is tomorrow. And then we'll be receiving 1.274 million doses on the 21st of June. And then what will also be happening is that the Pfizer that is coming from the COVAX facility will be arriving on the 28th of June, 1.392 million doses. And then on the 5th of July, we'll have an additional 190,000 doses coming from the initial pipeline that we had described previously. Going forward, we are still in discussions with Pfizer on how the scheduling is going to happen on a weekly basis, and we will report back to Parliament as soon as that scheduling has been finalized. Also with Johnson & Johnson, the discussions are continuing. Then we just wanted to demonstrate, for the sake of demonstrating equity, that all provinces are being supplied with vaccines. We can see that some provinces were requesting vaccines quite enthusiastically in the beginning, and they were vaccinating quite rapidly, KwaZulu-Natal being one of them. Not that they are not asking for vaccines now, it's just that, other provinces have also caught up. So in terms of ensuring that there's equitable supply. Everybody has ramped up, including if you look at Gauteng, it also increased its requirements, and it's now stabilizing at that figure. Next slide, please. In terms of our vaccination sites, we want to report back to the portfolio committee that we have got 576 sites that have been identified and accredited. Of this, 446 are in the public sector and 130 are in the private sector, with those breakdowns provincially. In terms of how we are planning to vaccinate our public sector workers, we want to just report back again to the portfolio committee that the Department of Public Service and Administration is a lead department, and it has partnered with GEMS to vaccinate insured and uninsured public service workers, and that GEMS has contracted with a service provider to provide these vaccines through a workplace vaccination program using mobile units, referrals to fixed sites, and these sites are currently being finalized, and registration and permitting is being fast-tracked once a site is identified. And provinces are working with GEMS and DPSA to ensure that information for the uninsured public servants is provided so that they can also benefit from the vaccination. In terms of additionally what is happening for public service workers and other workers in the sector, we have identified basic education as a sector that needs to be prioritized as a matter of urgency. And what has happened is that when we're looking for how we could source vaccines, additionally, Johnson & Johnson approached the department on the 2nd of June, indicating that they have got 479,000 vaccines that were available and that could be made available to South Africa. So as education had been identified as a priority sector, we believed that this was a sector that could be prioritized, and it's a defined population, and we could use the same approach that we had used for healthcare workers, where we vaccinate the whole sector using our EVDS capabilities and working with provincial departments of health and any other capability that exists in the basic education sector. Using to identify the workers, PESAL, school governing bodies, and the South African Council of Education databases. Next slide, please. So maybe let's move to the next slide. Just want to indicate that the Basic Education Department and Health are ready to execute the plans. And what has been reported on is that the SGB databases have been verified, and private school databases also have been verified, and dedicated vaccine sites for the education sectors have been identified, and dedicated programming for education sector only has also been identified and programmed. What we want to report back also to the portfolio committee is that of the 499 doses that had initially been 498 doses that have been initially identified, we are receiving 300,000 doses tomorrow on the 14th. A flight has already been booked, and it will, on the 18th, the flight has already been booked to arrive tomorrow, and the doses have received some SAPRA exemption on labeling. They have received a GMO certification, and then the National Control Laboratory is ready to ensure that these vaccines are released on the 21st of June, and we'll start distributing on the 22nd, and then we'll start vaccinating immediately thereafter. Next slide, please. Just to also report that based on what had previously been reported, that the vaccines have a short expiry, the FDA did some stability studies on the vaccines that they were going to supply to us, and the expiry date has been extended by 4 weeks from the initial date that was given, and we are confident that we can vaccinate all healthcare workers with the 300,000 vaccines within 10 working days. And what we are also saying is that based on the pipeline slide that we indicated, that there's 1.2 million more J&J vaccines that are on their way. This will allow us to vaccinate the additional 199,000 educators out of the 499,000 total educators that we have in the country. So we believe that all educators, 499,000, will be covered initially by the 300,000 that is arriving tomorrow, and then we'll have a top-up of 199,000 from the 1.2 million doses that will be coming next week on the 28th of June. What we also want to report on is that we are also in discussions with other sectors in the public sector, such as SAPS, the SANDF, and correctional services.
Dr. Kwina, how many slides have you got in your presentation remaining?
It's 5. So I'll just go through quickly through what we are doing in the private sector so that we can just have a sense. We've started with 416,000 of those that are above 60, and we'll be continuing with 4.8 million workers that are above 40 years subsequently. Next slide, please. Of the sites in the private sector, we have got sites in the mining, manufacturing sites, in state-owned enterprises. We'll be vaccinating the taxi sector and public service in Western Cape and local government in Gauteng in the next 2 weeks. In the private sector, the sites have been identified and are 145,000, and we can see that the majority of the sites are in the mining sector. And then what we also want to indicate is that there's discussions on vaccination in the workplace are taking place between B4SA and the NEDLEC process. Next slide, please. Then we want to recommend to the portfolio committee that it notes that the resurgence indicators, and as per the declaration of the president 2 days ago, South Africa has now moved to alert level 3. And then we also wish the portfolio committee to note that whilst the vaccination program is moving ahead, there are still supply side constraints. We don't have the luxury of ample vaccines in the country. We also want to the portfolio committee to note that registrations are not increasing as fast as we want. We are not yet at the target that we had set for ourselves of getting closer to 5.5 million people who are above the age of 60. And we are saying that we are going to be using a whole government approach to increase demand for registration. We are also going to be accelerating the implementation of the work-based vaccination program for the people that are above the age of 40 years. Thank you, Honorable Chairperson and honorable members of the Portfolio Committee.
Yeah. Thank you very much, Dr. Tulare. Honorable members, I was not aware that there's an ongoing discussion in our chat group. As I was looking, I only look at that when I have to check who has to speak on that. Now I notice there's been a whole host of discussions that are going on in the light of, Minister, that you will be leaving us in an hour's time. And flighting the agenda, Ms. Machalamba, just flight the agenda again, which at that time...
Sorry, Chair. My apologies, Chairperson Dromo. We are not done presenting. The digital vibe presentation is coming in.
Yeah. Let me then see, because there's one on them. There's one coming in between there. I think you were raising the issues of oxygens. Maybe that one can come at the end. Can we start with the digital vibes now? Because that is what I've been picking up, that members, instead of doing it on the, so we have done beyond the state of readiness for COVID-19. That one has been done, isn't it? Point B.
No, it has not been done. It's the one that follows on this one because they flow on each other, but we'll stand guided by the chair.
Yeah. the members should then have requested, and now they have requested after we started that let's do C and then leave B, because B and A questions might then be directed to you, DG, and your team. Members would like to get to the presentation on C and then engage with the minister before she leaves. Can we then do C?
Thank you. Thank you very much, Chair. My apologies. I'm trying to do screen. Apologies, Chair. I'm trying to do slideshow.
Chair, while the DG is looking, we haven't received this presentation.
Not received the presentation?
No, Chair, not this one, no. So others, but we haven't received this one.
Okay, but he can go ahead to present nevertheless, isn't it?
Yeah, I just say we must just get it from him, please, Chair.
Okay, thank you.
Thank you very much, Honorable Chair. Once more, good morning, Minister, Deputy Minister, honorable members. We will get our parliamentary liaison officer to share this presentation. We're going to, based on the initial opening remarks by our minister, we will just go through what is available now and the summary of the Ngubane report, the SIU process, and then we'll come to the conclusion. This is what was already covered in the last meeting, that when we received the final report of the Auditor General, there were some red flags that were actually raised by the Auditor General and requested the accounting officer to do some further investigation. Following this, Ngubane Tax Advisory firm was appointed with the following scope of work: to investigate the awarding of the contract, investigate the changing of scope of the contract from NHI to COVID-19, and to investigate on whether the department received value for money on the contract. So this work was then done, and then we finally received the report on the 24th of May, which was a full report from Ngubane Tax Advisory. And the main issues that that came up from that report, in terms of the main finding, was that one, the bidding process that was followed was in contravention of the PFMA, that the process of appointing Digital Vibes was irregular. The irregularity findings included, amongst others, inconsistencies in the bid committees and lack of disclosure of interest by some members of the bid committees. That an amount of 37 million paid to Digital Vibes constituted fruitless and wasteful expenditure. And then in relation to COVID-19 work, Digital Vibes received requests for work from the department prior to their contract being extended to include COVID-19. Requests resulted in a financial commitment of approximately 35 million that the department ended up paying after the expansion, before the expansion was approved. Investigators found that any amount paid to Digital Vibes for the work done before approval of expansion was irregular, as expenditure was incurred in contravention of the Treasury regulations. Investigators concluded that due to the fact that the appointment of Digital Vibes was irregular, the total sum amount of 150 million paid to them by the department was irregular and should be reported in terms of the Public Finance Management Act. This was the final report that was received from the Ngubane company. But before we received the final report, sometime in February, the DG was contacted by the SIU, informing him that they will be investigating the contract insofar as it relates to presidential proclamation regarding COVID-19 allegations of corruption. And then the following should therefore be noted, that the department has cooperated fully with this investigation by the SIU. They've requested a number of documents which were provided. They've requested some IT equipment of certain officials, which was provided to them. They've requested some affidavits from specific individuals, which were provided. They've had consultations with various officials, and including the Director General, and these meetings have taken place, and there's been ongoing communication with them. And with the Director General, the communication was actually as late as the last consultation with them was as late as on Monday. As late on Monday when I had the last communication with the SIU. But the SIU has not yet concluded its processes, and the report has not yet been handed over to the National Department of Health. As we are aware that normally the SIU, when they do the investigation, they also then do what is called a referral. And that referral is referral for disciplinary processes. But that we are still awaiting that, and they've promised that we should be getting that very soon moving forward. So what have we done as a Department of Health? Well, of course, we did suspend the contract in February, and we have reported the irregular expenditure to the National Treasury in terms of the PFMA. And I must mention that we have commenced with consequence management process in relation to wrongdoing by officials identified in the investigation report. However, on discussion with the SIU, they have mentioned that it will be advisable that we wait for the final referral from them, as they felt that probably some of the charges that are recommended in the report, they might actually expand on those charges because they have more powers. They might add to those charges. So it's better that we do a comprehensive charge sheet once they've actually done a full referral from their side. And we have done commenced the discussions with the Senior Counsel in relation to the recovery of funds as recommended by the report. But again, the SIU has advised us that they actually have mechanisms in place as the SIU, so we'd rather wait for them to work with them in terms of the recouping of the funds, because they have a necessary machinery as the SIU in terms of how to handle that, so they can work with us in this process. It is therefore essential to highlight that the department needs to wait for the report of the SIU in order to supplement the processes that are already underway, as new information may be presented. Hence, we request that the identity of implicated individuals, as mentioned by our minister earlier on, not be disclosed at this stage to avoid compromising the SIU investigation and consequent management processes that are underway. I will stop there, Honorable Chair, in terms of what we can present as guided also by our minister. Thank you very much.
Yeah. Honorable Minister, we'll hold it at that for now because we want to actually, as I was saying in the chat that I've received, the members would like to interact with the minister before she leaves, and some of their interests are on this report. And therefore, I would want to actually so there's been requests that came through. I did not notice that, honorable members, as I'm saying, when that was going on. I just noticed initially members who wanted to ask questions. I would like us to hold the third presentation and do it after, as members have been saying here. Look, some of these technical reports, the other officials can answer when the minister has left if there's a pressure. And I've seen the order of request in the following. Maybe then you can just indicate whether you are asking in relation to some of the issues that the minister has attention, because then we can engage with the DG regarding the other parts of the report, including the one that has not been presented. In this following order, the first one will be Honorable Imam Sheikh. Second one, Honorable Van Staden. The third one, Honorable Kwahube. The fourth one, Honorable Ismail. Then there was a whole host of discussions that came thereafter. I did not follow properly who else is coming in there now. Who would like to be number 5?
Chairperson, Dr. Tembekwayo. Dr. Tembekwayo, I think I was number 3. I'm supposed to be number 3, Chair, please.
No, check, go back and check on our chat group. We are not number 3.
Yes, it's up there.
You are number 5. You will be number 5. Check the
Honorable Minyai.
Number 6. I'm number 5.
Honorable Munyai is number 6.
Honorable I also raised my hand, Chairperson. I raised my hand.
Yeah, that's why I'm taking hands now.
I'm just after Dr. Susan Tembewayo.
No, you are after Munyai. Honorable Chira.
Then Honorable Sokacha.
Number 8, Honorable Sokacha.
Honorable Jacobs, number 9.
Number 9, Honorable Dr. Jacobs. Let me repeat the order so that one member comes after another one. The first one, Honorable Imam Sheikh. Number 2, Honorable Van Staden. Number 3, Honorable Kwahube. Number 4, Honorable Ismail. Number 5, Honorable Dr. Tembewayo. Number 6, Honorable Munyai. Number 7, Honorable Chirwa. Number 8, Honorable Sokacha. And number 9, Honorable Dr. Jacobs. In that order. Thank you. Start, Honorable Imam Sheikh.
Thank you very much, Chairperson, and thank you very much for the presentation. I guess my hands are tied in terms of asking too many questions on the digital vibes, because I think you've already alluded to the fact that you were advised not to give any names. However, my question that was going to be asked was, who exactly were the officials that started and concluded this thing? And that, I think, that is not privileged information. I still believe that the portfolio committee is entitled to that. But let me go back onto the issue of the rest of the presentation. Starting off with I want to raise my concern about the vaccine rollout, particularly, the law enforcement in the country, also in the front line. And it looks like now they're only going to get it after the educators and things get it. And many of them have been lost in the process. Now, Minister, you say that the healthcare workers, and I see in terms of your stats, we've lost a lot of them again. Can you tell us if there has been, after taking the vaccines, and these particular healthcare workers that may have died or been infected, was that after they took the vaccines? Has there been infections and or mortality or deaths as a result of taking the vaccine, or the vaccine did not help? The other question is, why are we not considering, given the fact that we have a problem in terms of supply with vaccine, and it's clearly there, while you're saying we are getting some of them, it's not going to be enough to be able to roll out them. Why have we not been concentrating on Sinovac and the Sputnik? In fact, some of them I know was at one stage offered free of charge to us in the country, which we have not. I'm not sure why we have none. Now, I want to ask a very important question here, Minister. There is a doctor in South Africa by the name of Dr. Sankara Chetty. Have you met him? Now, I know you have just come on board and I think you've been put in the hot seat. I would advise that you should go and meet this doctor. 4,000 patients were treated. Not a single one went to hospital. Not a single one died. Not a single one needed oxygen. Simple treatment. Identified the problem, very successful, giving world recognition. Only South Africa is not recognizing its own doctor. There's another report that came in yesterday from another Indian doctor. And if you watch his video, very close to what this doctor in Port Edward in KwaZulu-Natal is doing and saving lives. And I think it is very important, given the fact that we have a problem in terms of rolling out vaccines and people are not actually complying and a whole host of problems. This might be one of the solutions that can sit. Now, you talk a lot about putting in restrictions and wearing masks and social distancing, Minister. And I know you're going to be meeting with the Command Council and the President himself, even your very own party yesterday, and the EFF as well, have broken this regulation that you have put. I don't blame the EFF, to be honest with you, because on the one hand, you're saying the elections must go on the other hand, you are saying no gatherings and they need to campaign. And that's why they broke the law yesterday. How many more people have been infected now, are going to be infected and may have to die? So I would like to know, what are we doing there? And Chairperson, I want to suggest that the next time we have a meeting with the portfolio committee, with the department, that we should also call the Minister of Police to also come in so that we'd be able to deal with them. Now, what is disturbing with the money we spent on communications, and there is, you might be correct, there is a lot of conspiracy theories, but I'm not sure why you say it's already conspiracy theory, because this has not really been thoroughly investigated. However, South Africans are psychologically being drained because of the negative publicity on vaccines that is going through their minds. People are stopping the last moment. They don't want to take it because of the fear of all the social media platforms that are full of giving people information that may not necessarily be true. Now, the other question that I have is SAPRA chairman, the minister, was supposed to give a report in terms of the court settlement. Every, I think, month or 2 months, they are supposed to give a report on ivermectin, where there's more reports coming in on its effectiveness, and they have not been giving us these reports. Can you please tell us what is happening about the reports that SAPRA is supposed to have been giving us so that we could get an update on this? Now, I have a serious problem, Minister, with your statistics. And I'm going to give you an example. The other day, you reported 153 in-hospital deaths, but 114 total deaths in the country. The next day, you reported 59 deaths in the entire country, 78 in-hospital deaths. That's how inaccurate your stats that is being provided on a daily basis. It means that we cannot rely on the stats that you are actually giving us. I'm not going to touch on the other thing. I'm going to leave it for my other colleagues. I think I can give because we have time constraints. But I would want to urge, Minister, that if we're putting in these regulations together with SAPS and things, can you speak to your command council to make sure people are compliant? The problem out there, we're in a crisis with this virus at the moment, absolute crisis. The number of teachers that have hospitalized and died in the last couple of weeks is unbelievable. I can tell you now. And these things are all, being suppressed, and we're not really getting this information. So I want to urge you to look into this thing, but particularly meet Dr. Sankara Chetty and come back and tell us what you have found. Thank you very much.
Can I proceed, Chairperson?
Please continue one after the other, please.
Thank you. Now, with greatest respect to the acting minister Ngubane, I don't think she will be able to answer the questions on digital vibes. That's why, and I think I've been misunderstood in this committee. That's why I'm saying from the beginning that the minister is now on special leave, come and appear before the committee and to come and answer questions. This report, with all due respect, sir, which we have received now, for me, it's a bit disappointing. It's not giving us the information, according to my eyes, that we need to get on this matter. And therefore, that's why I'm saying that the person who's involved in this matter and is on special leave must come and appear for us. I just want to draw your attention on the direction that the Constitution said to us in Section 55(2), that the National Assembly must provide a mechanism to hold to account executive organs of state and maintain oversight over the national executive authority and any organ of state. I'm taking this now out of the legal report we have received, and also Section 92(2) of the Constitution that provides that members of the cabinet are accountable collectively and individually to Parliament for the exercise of their powers and the performance of their functions. So therefore, Chairperson, I would like also to draw your attention to the rules of Parliament, Rule 167 on general powers and subsection A, where it says, for the purposes of performing its functions, a committee may subject to the Constitution legislation the other provisions of these rules and the resolutions of the Assembly. A, to summons any person to appear before it to give evidence on oath or affirmation or to produce documents. Therefore, Chairperson, I would like to suggest that this committee must submit a report to the Speaker of Parliament, who will consult with party whips of all the various parties, and if agreement is reached there on that forum, then they must send the relevant communication to the minister, which is now on special leave, to come and appear before us. Mm-hmm. On the update of the vaccines, which was also now showing to us, the department was now talking about mass testing. But don't forget the matter of mass screening. Last year, under lockdown level 5, when the outbreak just started, the department in all various provinces tried to went from home to home to conduct screenings in communities. But I'm of the view that this, and I've said it last year also, and I'm saying it again, But that matter must continue to unfold, because this virus must be hunted down and the virus must not hunt us. So therefore, I would suggest that the mass screening in communities must take place again. Now, we have seen what happened this weekend by the Honourable President, who was moving us back to lockdown level 3. But due to, in order to curb the spread of the virus. But Chairperson, we all knew what we saw last Friday at the Kopanong Hospital in Vereniging, where there's millions and millions of rands of medical...
We're going to come out of that to say goodbye, but just the Portfolio Committee on Health meeting on various issues, including the outcomes of the Ngubane report. This report on the Digital Vibes contract, finding that the contract was irregular and money spent on communications on this contract was what do they call it? Fruitless spending or irregular spending. But that conversation will continue. More political parties wanting to ask the acting Minister of Health, Mmamoloko Kubayi-Ngubane, some more questions as more detail was not given in terms of this report and the status quo of the SIU process on this contract. Let's say goodbye to you. Thank you so much for watching. Till next time. Bye-bye.